Huh?
Hey, Jacori.
Go ahead. Ejika, is that your iPhone? Ejika, is you the iPhone?
No.
Hello, John. Can you hear me?
Oh, so you're Patel, the iPhone.
Yes.
Okay, so who's Sabina? Who's Sabrina?
Vivek or the Arthur? He's the lawyer.
Who's
Hi.
Sabrina? Who's Sabrina?
Sabrina is my assistant. Hi, this is Arthur Perlman.
Okay, so
I'm
okay. We'll put it on. We'll put it on.
Not that one.
Who is Joy? Joy 24/7. Anyone know?
Nope. Nope.
No one knows who Joy 24/7 is.
Nope.
Let me see. He has to hold on there. We're having some trouble with our
Our Zoom
Zoom
setup.
Zoom setup. Hold on a second. Jaika? 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 Are you there? Jaika?
You can ask them, you judge by yourself,
No,
but wait, I mean,
sorry, move it.
either that or ask them, right? Identify themselves.
Can you identify yourself, Joy 24/7?
Did I respond?
Yeah, this is Vivekanand Patel from Richdale Food Shop, Exchange Street.
Who's this?
Richdale, the shop.
Vivekanand Patel from owner of the Richdale Food Shop.
Okay, whose iPhone then? Who's on the iPhone right now?
Here we go.
Yeah, I guess so.
Maybe the manager, Kevin, is your iPhone is you?
Yeah, iPhone is mine.
Yeah, identify yourself.
Yeah, Kevin Patel, manager of Richdale Food Shop.
Okay, so you guys are separate, right?
Yep.
So one of you is an iPhone and one of you is Joy 24/7, right?
I don't know.
Okay. Okey dokey.
Go ahead. We're sorry, some technical difficulties with Zoom, but it is 6:12 PM. I would like to open up the October 20th meeting of the Board of Health, Town of Millis. Do I have a second?
Second,
Okay, all in favor? Aye.
aye.
We haven't gotten hold of Corey yet, so it's just the two of us.
Okay.
All right. We want to move to Rich Dale's agenda item. For the nurse report later.
Yes, we have a Rich Dale's citation. Selling a tobacco product to a person on the minimum legal age. And they are probably listed within 3 years, so second violation within 36 months. And first violation, a fine or a $2,000 violation and a possible permanent suspension for at least 1 day and up to 7 day consecutive days as required by state law, or for a long term as promulgated in the local regulation. And we have here also the individual who was the tobacco control person. Want to say it?
Yeah. It's fine.
You can say how you.
Okay, so what was the event that occurred?
Yeah, Millis Board of Health did a compliance check in Millis all tobacco retails, and there was a sale to under the age of 21 to a minor in Richdale on September 13th around at 11:25 AM. And based on which the cease and desist letter and the violation of $2,000 and citation has been submitted. I think the retail owner has paid the amount of $2,000, and we are here to decide the suspension for the second violation of sale to minor as per the state law.
So may I speak? So the issue becomes, will the board, say 7 consecutive days? He has to not sell anything for 7 consecutive days, or they could go down to 1 day. This happened 3 years ago, and what I recall, the board allowed them, instead of 2 days, to get 1 day suspension. So this one is 7 days or 1 day. So the board can reduce those days if they feel it's necessary. And this is the sales, they did the sales for this. Say, what is this called, design?
Zen,
And then,
we have the pattern.
Right.
Yeah.
I can see it as well. That was sold.
And the store was provided educational visits 2 times after the first violation, which happened September 25, 2023, and the second educational visit happened in April 2nd, 2025. So after these 2 educational visits, the second violation has happened in the same store.
They did pay the 2,000 though.
Okay, so we're just deciding the length of the suspension from selling tobacco products. Did any of the store representatives want to speak?
Yeah, hi, my name is Arthur Perlman.
Okay.
I'm not hearing clearly, but I think you said that I should speak now. Is that right?
Yeah, if anyone from the store wants to speak about the
Okay.
violation.
Right. Look, a couple of things. One is, after they had the first violation, first of all, understand they take this seriously. That's why everybody is on this meeting. It's not just one person showing up. Everyone is here. After they had the first violation, they put in a system so that everyone had to show ID if they were going to buy a tobacco product. What happens is that system, if someone's clearly old enough, they can hit a button and clear it. Obviously, the person on duty that day abused that privilege and cleared it without doing their ID. They've now upgraded that system, so now you cannot clear it unless you actually have a driver's license, so you can see what's going on and that that person's over the age. So I would ask you to consider not, and can I say one other thing too? I'm confused. I've gone on your website and I've got your regulations, and I don't see what you're saying for penalty on your regulations. Your regulations talk about a sale to a minor. Is that what we're talking about, a sale to a minor, or are we talking about some other kind of sale?
Now, this is the sale to minor as per the state law, 105 CMR 665.
Because your regulations kind of set forth what the penalties are, and your regulations say that for a first offense, it's $100. And for a second violation within 24 months, and this is outside of 24 months, the last one was almost 3 years ago, it's a $200 fine, and you may be suspended for up to 7 days. So I'm not sure where this $1,000, and I know the Department of Revenue has different standards, but those are primarily for sale of flavored products, not for sales to minors, but for sales of flavored products, including menthol cigarettes. that they have fines of 1,000, then 2,000, and then 5,000 for a third offense. I'm aware of those. But I think I thought we were dealing with a Millis violation, not a state
This
Department
is
of
a
Revenue.
state violation of the law. If you look under 665.045 in the law violation, it says $1,000 for the first violation, second violation with a period of 36 months from the first violation, the fine of $2,000 to be imposed. A prohibition of sale of tobacco products may be imposed for at least 1 day and up to 7 consecutive business days, or for a longer term enacted, adopted, or promulgated in a rule, regulation, or other measure appropriate and legally designated health authority of the city, town, or their legally constituted government agent within the Commonwealth.
That makes sense, something as well, that anything that's state, that's more strict than local, it takes over, period.
Okay, all right, I was just confused. I went on your website to find out what I was dealing with, and that's what I came up with. I've dealt with the state, I've dealt with Department of Revenue, and I understand what they've done and how they do things, but I never did it with a city or a town before, but that's fine. The only thing that I would ask of you is to consider, they are taking it very seriously. They did something the first time to try to stop it. Like I say, one of their clerks obviously abused the privilege of being able to clear it if someone was clearly over the age. Now, they don't care what the age is. Every person coming through, you can be my age, 80 years old, and you're still going to have to take a driver's license and make sure that they're the right age. So they are taking it seriously, and they're trying to make sure it doesn't. I would ask you to consider that if you are able to say that it could be 1 day to 7 days, that you do consider maybe the 1 day suspension, and the fine is the fine, and I'm not debating that with you. But I would ask that you not suspend their license for 7 days.
Anyone else want to speak from the store?
I think that I was speaking for everybody.
Okay. All right. What's the board consider? Matt, you have any feelings on this?
I do have a question. Apologies for not being there in person. I haven't met the man that's there, but is he the one that they sold to?
No, they
No.
sold to youth inspector who's the age of 17.
Okay,
I'm a
thank you.
tobacco control program manager for Metro West. I'm a
Okay.
tobacco agent for Millis.
Okay, yeah, that's why I was confused, because I knew you were a tobacco agent, and I was like, well, to be fair, I wouldn't card this guy either. No different than I probably wouldn't card myself. But knowing that it was a separate agent is
Yeah.
helpful.
You look young.
Yeah, I know.
But from now on, we're carding you too.
Yeah, sure. That is the education what we give them to card everyone, irrespective of the age.
So I do want to be clear, or ask to be clear about our regulations versus the state regulations. I do remember a couple years ago when this happened, and I think we did go with the state regulations. But is there a provision in our regulations, because I didn't see it when I looked, that says something about, you know, following the state if they're more strict or anything like that? Or I just want to make sure that that is clear.
To make it clear, Commonwealth of Massachusetts made very clear that in public health matters, state law, the Board of Health rules over state law, but state law is a fundamental foundation for any public health matter. That currently Millis tobacco regulation is being reviewed. Considering the statement, whichever is the higher fine or suspension will be provided for any conditions like this, sale to minor or flavored products. The state law overrules takes the Board of Health regulation gift, because as of now, Board of Health is having 100, 200, and 300, and surely we'll go for the higher range, which is the state law. That is how it's going on now. Maybe down the line, maybe in 2-3 months, the current regulation of Millis Board of Health will be updated, which is equal to state law. So until then, we will be going with the state law, which is the health.
Okay, thank you.
Yeah.
Do we know if Jai Carr is going to be joining us tonight?
We have not heard from Jacob tonight.
Okay, I don't know if we can necessarily wait on this, and I guess that's a question to you, but I would feel more comfortable having the full board here if we're going to be levying large fines or multiple day suspensions versus just the two of us. I know that that's not a requirement because we're a quorum, but I would just, is for the chair, I would give that to you for your consideration.
I believe the fine has already been levied, that was not. part of
Oh,
the
that's already been
discussion.
levied, so now it's down
One day
to,
up to 7 days, that's the only
Okay.
thing we're deciding, is one up
Okay.
to 7.
well, I'd submit a similar thing, but I'll also just give you my opinion, which is, I do appreciate that they put a system into place. We have found a failure in that system. They have remedied that. So I would be supportive of less than 7 days. I mean, honestly, I would be comfortable with 1 day, but I also understand that I'm just one member. Barring that action, though, I would have felt much stronger about multiple days.
And we're sure there's no way to get around this electronic system you put into place that allows the cashier to avoid the ID check. That's good.
It depends upon the person who is, who is standing there, whatever system you keep there, depends on the person who sells the product.
So they can just go in there and put in whatever date they want, anytime. Is there
It depends upon the system what they
a
have.
system?
Yeah.
Okay.
So this doesn't prevent sales. No matter what they do.
No, because we are not monitoring inside the store whether they are carding everyone or. That's why we are giving the education for them to check ID for everyone, whether they have a system or not.
Do we know what the system requires you to put in? Is it just a date, or I'm assuming you don't track license numbers and that sort of thing?
No, we do
No.
provide, I'm sorry to break in, we do provide a FDA age calculator, which is there in the store. It is enough to just check the dates on that with the driving license to check the age. That is what we train them with.
It's like a scanner?
It's not a scanner, it's a date automatically changes. So if you cross check with that, if they are very clearly, it says they are below 21 or not.
Okay. So
You
just
don't
like a
need
calculator.
a big system to scan it or. Yeah, it is there in all the stores, including Sting, which has been provided by us.
Okay, so the sales clerk knew that the person was under an age.
Yeah, so we train them to check the ID, and we train them, the complaint check happens under Board of Health, under FDA. These checks happens around the year. That is how we train them, and after the first violation, we gave 2 rounds of training on that, and this is the second violation.
Alright, so Matt, we gotta decide whether or not we wanna. How long the suspension should be.
You guys, maybe can I speak?
Go
You
ahead.
guys could do 1, you could do 4, 3,
We can
5,
pick
7, whatever, maybe 7 is gonna be.
Yeah.
Pretty. No, they could tell us what 7 is gonna be for them. It's gonna be more than $2,000, let's put it that way.
Truly speaking, from my point of view, state, or say trainings. They don't allow any reduction of 7 days or something. For third violation, it is 1 month. And again, it is the board who decide how many days they're going to go with.
that.
As it is a state law, then it's up to the board whether to obey the board law or state law.
Yeah, the state says. We have to follow state law.
Yeah, are we very clear on the timeline of past violations, just so we make sure we are following that? Or maybe you guys have already looked at that.
Yeah, it is within the 36 months.
Yeah, it's within 36 months.
Okay.
First violation, and then they had education shortly after that first violation, and then they just had more education this April. About ID checking.
This gives the clear timeline for you.
January 28th, 2013, they had a
The highlighted
violation.
is the education itself.
When they came to the board. February 13th, 2013. Board heard them at that point. And he did pay $1,000 and they suspended for 2 days, they granted him one day. This board, so.
Okay. So it looks like it's been 5 months of a second training. This is the second violation. They're scheduled for training September.
Oh, the second hand copy.
Oh, thank you. So after the first violation, you put in a system to scan, to block out the sales without putting the date. Is that what I'm understanding?
What was that?
The store put in a system to check, to enter the date before allowing the sale? Is that what you did?
I'm sorry, say that again?
After the first violation, you put in a system to check, to make them check the date of the,
We put in a system to check IDs so that if you had it, it would come up, it would block the screen and it'd say you need an ID. The problem with it was that if someone was my age, they could just hit a button to clear it and not have to take the ID because clearly I'm well over 21. What they're doing now is they're changing that system so that you can no longer clear it. You have to have an ID given to you so that you can check it and put in the date of the ID. It stops that. So I mean, to violate it now, the clerk would have to take positive action to violate, wanting to violate, basically wanting to violate it by putting in a date without getting that license. You can't just clear it. You have to put in a date. So it pretty much stops someone from being at least lazy or not hating their boss and wanting to mess them up. You gotta go and do something now to really mess them up.
noted.
Not a second violation and done. Not after the first.
Okay,
So may I say something as well?
go ahead.
January 28th, 2013. You guys wrote a letter. Kevin Patel wrote us a letter, but he said in it, we have an ID scanner operating during all open hours to confirm the validity of the IDs of customers requesting nicotine. So how did this not basically make it assured now back then?
Well, I think they felt back then the employees would do it. I've had stores myself. I've had liquor stores, and it's same kind of system. And it comes up and it blocks the screen and says you need an ID because you just sold or you're trying to sell an alcohol or a tobacco product. So you then tell the client, I need an ID. By the same token, if I look at the client and they're my age, I can also just hit a button that says clear. And it goes away from the screen and you continue on with your sale. But you expect your employees to do the right thing. Well, now they've spent more money to get one that you can't hit clear. Now you're going to have to enter in, you're going to have to get an ID and enter in their age, and then it will clear itself. You can't clear it. It clears itself because you've now put in an age. And if the age was under 21, it won't clear. And you can't sell to that person. So you've taken away the prerogative of, and we did that. We had a store that we had to take it away. And we thought at first they would do the right thing and someone didn't do it. And we did that too. And we put in the kind you can't just hit a button to clear it.
Very interesting as well. Now you have cameras as well too that can judge what the salesperson's doing, right?
I don't want to say that because I don't know. I don't know. I know we have them and I think most stores do have them, but I don't want to say, I haven't been in that store. I don't want to say that they have cameras. I could be wrong. I'd say most all of us have them. And there's rarely one that doesn't. If you're gonna have employees there and they're gonna be selling, among other things, lottery. You want to make sure you know what's going on with your employees. Because otherwise you could end up losing very lot of money if they're screwing around with your lottery. So most stores have it. But I don't want to say that they do because I haven't been in the store.
There are two representatives from the store if they want to answer.
Yeah,
Vivek, are you still there? Are they
Yes,
still there?
I'm still here.
Do
We
you
have,
have,
we have the camera, but that camera is outdated. So we can go physically go back and check, but I need to upgrade the system so I can monitor by like online remotely. That I need to upgrade that system.
okay, so there are cameras there, but again, most people don't watch their store all the time it's open.
yeah, just be available to go back and look at what happened at the time in question.
Yeah. It's reason to fire someone, but it doesn't help you as far as
Yeah.
violating the thing. So that's the problem. That's why the system where you can't clear it makes more sense. Once you realize your people, it's sort of like if you go to Fenway Park. You can't get a beer there if you don't show them a license. I could go up to get it, being 80 years old, and they won't sell to me if I don't give them a license. They just won't do it. Because they can't trust their employees. And that's sort of what this is doing. It's saying we can't trust our employees to do the right thing. So we're putting in a system where you can't just clear it and you make the determination that someone's over 21 or that you're just too darn lazy and you just clear it because you can't stop and say, can I see your license? I mean, that's pretty low bar, but that's the bar you're trying to now wipe out so they can't do it without affirmatively trying to mess you up. I don't think that they have debated with you the amount of your fine. The only thing I'm requesting you to do is not to give them a long suspension. If you're gonna suspend them for a day, suspend them for a day. But don't make it a lot of days because that's just hurting them beyond what's necessary with these people who have taken action. It's not like they're sitting there saying, we don't care. You know, you got your law, but we're not going to worry about it. No, they take it very seriously. That's why everybody showed up. That's why they changed their system again for the second time to make it even more difficult. I don't want to say anything's impossible, but making it more difficult for anyone to mess up. So I think they're taking the appropriate action. I think they're responding to you. And they haven't, and they've never debated the amount of fine. I just asked you that because I read your statute and your regulations, excuse me, you know, which said
Ours is
something different.
superseded by the state. We have to follow the state's regulation. They supersede Millis.
But if that's the case, then you really should change your regulations. This, because you're never gonna follow them. Your regulations say something, but you're never gonna follow them. You're always gonna say,
Well, we're gonna
Okay.
update our regulations shortly, that's like not for tonight. All right, so for the suspension, I think they've made some efforts to try and change their practices to improve their screening abilities for avoiding selling to minors. They had a 1-day suspension last time, would it be fair to get 2-day? What do you think, Matt? One more than last?
I will say that I'm supportive of a 1 day, but I see your logic for a 2 day and wouldn't argue it extensively.
Well, what's your feelings on this?
So my feeling is that they instituted, like, systems fail. It worked for a while. It failed. They instituted the next change that they can. I would say, though, that if this doesn't work, then a longer fine is required, because there's not much more we could implement to make sure the right thing is done. And I personally, I'd like to believe that I'm sure someone was in a hurry and it's easy to just press enter. It's much harder to do that with a system like this in place. So my hope is that it will actually help people do the right thing, because it's easier to do that than make things up. Right? It's easier to take someone's ID and look at it than just to make up a date. The other thing I like about the system is it takes the responsibility sort of away from whoever is the cashier, because they're not making a call now on like I would assume I look older than 21, but they're not making that call. They're just going to an ID. And so I think it's just a step in the right direction. And there has been quite a bit of time. I'm forgetting how much we've said, but between the last violation and this one. So I just don't feel like it's warranted. But again, I don't feel so strongly that, I'd argue with you about it for 2 or 3 hours.
Has been like 1 year and 8 months.
2 years and 2 years and 8 months, yeah.
Sorry, and I will say this is one reason why I kind of wanted Jaikarr to be here, because it probably is better to have 3 opinions. But what I don't know is if we are, I don't know if allowed is the right word, but if we should sort of wait on finalizing this or not. I'm sure that the business owners don't want this to just be up in the air. On the other hand, because we seem to have slightly differing opinions, I do think it might be useful to have our other board member here.
Well, they make some good arguments. They did make some efforts to change and to be proactive to prevent this from happening again. I could go for a 1-day suspension. Should we vote on that?
Yeah.
Any further discussion? All right. All right, motion for a 1-day suspension for the Litchdale store of their tobacco license.
Do we need to determine which date that is and specify?
Do we?
Yes, yeah,
Oh,
normally you do.
I vaguely remember we discussed it with them last time. For what it's worth, we tried to be reasonable and not pick the highest day that they have for volume of sales, because I think they kind of know that. But
probably not.
but anyway, I do think we have to pick a date. That way it's clear for everyone.
Okay. Good calendar.
I also don't know how long it takes to implement that. I'm assuming if they wanted to implement that tomorrow, they could. But I don't know if they need to get official letter from John or sort of what the legalese involved is.
Looks like last time it was a month out. So the violation was January 28th, 2023, and the suspension day was February 21st, 2023, so about a month later.
I don't think there's any need for that type of a time frame, but it's up to you folks.
I think it's gotta be officially sent out.
That would be my guess. I'd want to make sure it was really clear to everyone.
See, it's my calendar. About how much time the,
I was gonna say, I mean, do you want to go out 2 weeks or something like that? I don't know how long it takes to do these things. I'm sure John can put a letter together tomorrow and certify mail in a few days.
that'd be like first week in November sometime.
That's what I was thinking.
Excuse me, may I ask something? Now, what day do you pick? It's Monday,
Yeah.
Tuesday, Wednesday,
We pick a
Thursday,
day.
Friday. I think Sunday's a little. But that's up to you guys.
I would argue for November 3rd, just 2 weeks from today.
Makes sense. November 3rd. Alright, so amending my motion. Motion for a 1-day violation related to the tobacco regulation violation for Rich Dale's to occur on November 3rd, 2025. It's a Monday. Can I get a second?
Second,
Okay, all in favor?
aye.
Aye. Okay, 1-day suspension for Rich Dale's, occurring on November 3rd, 2025. We did make it 1 day just because we do appreciate that your efforts to improve your system and prevent this from happening again. Just be aware that the third violation, which I don't think you have much more time, 36 period, but third violation will be $5,000 fine imposed, prohibition of sales of tobacco products imposed for at least 7 consecutive business days or up to 30 consecutive business days. So keep that in mind. That's the next step in the state law. And the state law is 65.045.
For your record, you want on the record that we waive any sort of appeal that we might have is hereby waived.
Okay, thank you.
Thank you.
Appreciate that.
We should make sure to note that in the meeting minutes.
Right.
Appeal waived. All right. For that document will be out to you officially shortly.
Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you, John.
Thank you, Kevin.
Thank you, John. We'll make sure more.
Thank you.
Okay, what time is it?
6:49.
6:49, all right. That's fair. All right, thank you very much.
Thank you so much.
No. Oh, thank you very much.
Thanks.
Thank you, George.
Next on the agenda is putting on our well rig.
I was just gonna say, we don't have Jack out there, so we're,
I feel like we all need to be here.
yeah.
I mean, it's up to you, Carol, as chair, but that's just my feeling.
Well, we can amend them anytime, but I'd like to move on to septic regulations. Cause then.
Well,
we
there's
got them back.
nothing, I guess there's nothing stopping us from moving on necessarily.
Are we comfortable, you and me comfortable, what went out as to the well regulations?
Yes,
So no further changes we would like to make.
none that I would want to make. My concern was that they're always signed by us at the end. And if I were Jaikar, I wouldn't want to sign something that I hadn't voted on.
Okay.
Now that's just my opinion. It's up to you.
And I think it makes sense to wait since let's put off the vote on the new well regulations. Won't make any changes to it with our next meeting. We'll vote on it next meeting. It's 6:50. We're moving the agenda item for no well regulations to our next meeting. I would like to propose we start looking at the septic regulations. Because I think next meeting, we're having someone ask us once again to look at septic regulations, so may start doing our background research. It's
Yeah, that
fair.
makes sense.
Okay. Or pull it out. I got mine somewhere. All right, agenda item, yeah, Tom Roach is not here, so let's move to the next one. Nurses report. Let's jump to nurses report.
Okay, let me get that.
And I finally met Ann.
No, that's that.
Finally met Ann.
Yeah, Ann, yeah, she's been around for a while. She's very good.
Yeah.
She's temporary, but she's good. And she's.
That's okay.
I was gonna say she's not interested in permanent, right? She likes the temporary.
Right.
Yeah.
Well, maybe she make it easier, not have a health fair, not have like all the.
Yeah, but she came to the, oh, she did, but she
She stopped
came,
by
she
and
stopped
said
by,
hi.
right, yes. Yes. And this is a report this.
Okay,
Yeah.
3 Lyme's disease, 4 COVIDs, yeah, COVID's on the uptick.
Mhm.
Anaplasmosis 1, don't see anything else. Very phase up height of pandemic, yeah, but it's increasing for this winter again. Flu burden currently low. Everybody get their flu shot, no one's listening to this, but everybody gets their flu shot. And a COVID shot. Okay, so we're doing a flu vaccine on this. We did a flu vaccine?
Yes, we did, right here,
Oh, okay.
October 16th. The high dose was done at the COA
Okay,
along with the help of
firefighter,
firefighters, Stephen Tyner,
Oh.
who's an RN as well.
that's nice.
And, and Sarah was there too, helping out with
Oh,
the colors, things you had to help them load them on the
that's
a
nice.
DTH computer. So it was pretty good.
Okay.
Home visit for vaccines as well. Yeah, and tick-borne illness, this is a very high, given to my eyes.
Okay. Lyme endemic, okay. Yeah, the ticks are.
Yeah,
going down.
that's always a big one. Yeah, no matter where you are. Massachusetts, you're,
Let's
you've
do
got
like a
problems.
almost like event Lyme disease.
yeah.
Alright, public health nurse. Yeah, like for our flu clinics, we can ask the. MRC. Medical Reserve Corps, they do flu clinics for
Right.
towns.
Yeah.
We need help. Uh,
John, is there an update on a new public health nurse?
Well, we're having a meeting with Medway. I think it's tomorrow, Wednesday. And we may, have a, I should say, Medway and Millis may split the nurse. And we won't hire that until the springtime. So June 20. Well, July 2026 is gonna be the time with the budget is adjusted for each town.
Oh, okay, gotta get almost a year without a nurse.
Well, yeah, from now until July 2026, 6 months, 8 months, whatever it is, but you still have Ian.
Yeah, she'll help
Still
out.
help out, and then we also have people from Metro West, the genealogist that can help out as well. So,
Just
I'm just
wondering, like,
curious. Sorry, go ahead.
if some highly contagious disease starts spreading around Millis, would we be aware of it in a timely manner, or would?
oh yeah, because Ian's on,
Okay.
she knows Maven very well, so
She'd let you know.
she let us know, yeah.
Go ahead, Matt.
I was just gonna ask, let's pretend you did, for lack of a better way to put it, split a nurse with Medfield or Medway, which one was it?
And then,
How like does the hiring process go? Like, do you and the other public health director have to agree, or sort of how does
we
that? Yeah,
have to form an agreement.
okay,
And the town managers or the town administrators have to agree on this. May have to actually have to go to the select boards as well, and maybe ATM as well might be possible as well.
okay. And sorry, I wasn't clear with my question. Let's pretend all of it gets approved and you go to hire person X. Is the process that you and the other public health director would interview this person and then come to a joint decision?
Yeah, it'll be us and the town managers and the health, resource people as well,
Okay,
both towns.
If we split a nurse, like right now, it's only 10 hours a week, so if we split them, would it be 20 hours?
20 hours, we're looking at 20 hours, yes.
So
10,
you
10,
get-
10, 10,
Okay,
it'll be easier to find someone that way, right?
yeah,
yeah.
I would think at least.
it might make it easier to do the job, kind of like if you showed that job to me, it's like 10 hours, you want me to run a health fair? And flu clinics, really?
Yeah,
That's
it's
a
a good point.
lot. Yeah. But we'd also be splitting the training they go to. Cause like,
Oh,
I know Sarah
That's
used to
a
go
good
to a
point.
lot of these trainings for public health nurse, we'd be splitting the cost of that training, so
Right, yeah.
make sure they remember that.
Yeah, right, yeah, that's true. Yeah.
Okay. Any more questions on the nurse report? All right, next one is, can we do the meeting minutes from last time? Were they able to?
I thought we did.
We did, we have the ones from last
Okay,
time.
I thought she said something like she couldn't do them. Or was there some front of them? Proctor's part, okay,
What do you want,
no, go ahead.
do you want mine, or do you want the,
I was wondering if we had minutes from last time.
what do you want on?
The minutes,
Okay.
it's 7:15 was supposed to be the minutes, but
What's noise, yeah, really, this. I'm good. Huh. Okay. Meeting minutes.
Yeah, download them and, so we can,
Okay, yeah, right.
so I can change them. $7 o'clock, and we are working on our meeting minutes for September 29th.
Here it is. You wanna, if you wanna do that, that's fine with me.
It's like to keep up with the minutes, so we're always like, up to date.
Yes.
All right.
We did a lot the last time.
Yeah, we did them all. We
We
knocked them all
one
out.
thing,
Me and Matt are
Yeah.
fast.
yeah.
I'm preempting that. Okay. And comment, enter public health, learning, support and public health. Continue to discuss review and update regulations, that's fair. Okay, and then we put down a lot of minutes.
Looks good.
Good to meet you. See, okay, bottom page. Okay. Well, this is wrong, because she wasn't there.
That's a good point, because it did say that in the beginning, didn't it?
Yeah. Did you motion, Charter, did I?
You know, I don't know.
Alright,
We could confirm that.
okay. Let's see. Just go for that. Check. What time is that? 7:53, 7:53, meeting. Adjournment, motion, orders. That makes sense?
Yeah.
Alright. I'm going to save as. Check. Alright. Send that to your desktop. We can't approve it because we gotta find out who made the motion to close the meeting because they put down Jacor and Jacor is not there. So I put my name, I think it was me, but I'm not 100% sure, so if someone just check this at 7:53, which one of us said I motioned on this meeting. That's all we need. And then we can approve it next time.
Yep.
Unless you remember.
I don't remember. My gut feeling is it was you, but I just don't know.
I feel like I was making all the motions, but I don't know.
I can't tell.
Yeah,
I don't know.
it was, yeah. We'll check on that one. And then
Right.
everything else looks good.
Yeah.
Alright, so we'll do the director's report. Man, it sound like.
Director support 10/20/25. The food inspections. Myself and Angelo.
Okay.
He does the more, difficult inspections. He's very good at these inspections. And the new restaurant was open. I don't know how to pronounce this. Arigina. Regina, it's an Irish name
Okay,
and he's,
yeah, it's the one in Roach Brothers Plaza.
yes, but it's what beside that. Right? But it looks good. And he opened it. We opened it, so should be nice.
Rocky's Hardware has food?
Yeah, they only have cans. I mean, sorry, they have candy and,
Oh,
you know,
okay.
stuff like that. There's nothing really much there, but we still have to inspect them. So.
Yeah, I wondered the same. I guess that makes sense.
Like, what food?
Now I know I can buy candy there and it's okay.
It doesn't take me that long either, because the candy and stuff like that,
It's at the restaurant.
yeah. So, yeah,
All right,
Title V inspection for 64th Street, with building on it, we had to do a, walk around with the building department on, they basically had to put a deed restriction because of the way that house is built and how many bedrooms are in there versus what could be. So he's gonna sign have a deed restriction put on the property. So, okay. Birch Street Town, the town has a tight tank going in there off Birch Street. Yeah, so it's where there's a well. And they're doing some type of, I don't know what to try, the PFAS thing that they're putting up there. It's like $6 million worth. And they're putting in a building there with the PFAS and the, what are they called?
like another PFAS remediation.
Right, exactly, right, like they have at the regular place. They have this, put one there and they put in a toilet and stuff, and they have to do a tight tank for it. So I do not check the tight tank.
Right.
210 Causeway, D-box. Septic test, there's no septic test thus far. Housing camps, complaints on this, Stony Brook, still working on that bat action at that Stony Brook building. Wildlife is, the person who's doing wildlife is there trying to get these bats out of the roof.
Have any residents needed to be relocated or they're all fine where they are?
They're fine where they are right now. So, apparently that's what the issue is that these things are stuck up in the attic. And this individual's gonna learn how to trap. They don't trap them, they let them out and then they block their way back in.
There was special, like, one-way entrance they put in
Right.
their holes, so they
Right.
can go,
Go up and they can't come back
go
in.
out, they can't go in. But you gotta make sure they not have pups or anything
Right.
like that.
Yeah. Yeah. They're endangered species.
Yeah. They're protected by state law.
Yeah.
Possibly federal.
Yeah. On Main Street we inspected and 210 Pleasant Street housing, I just went to that. Housing issues there,
Okay. Right.
and then. The Willis Fire Department did Board of Health open house and health fair. We had that day, it was good, you were there as well.
Yeah,
It was pretty, there's a lot of people there. A
yeah.
lot of people, like, I remember our health fairs, we didn't get that many people at all.
Well, it's because they had to touch a truck.
I know.
Like-
I know,
They're not coming for the health fair, they're coming
I
to
know.
touch the truck.
I know. So it was like, really, it's something else,
Yeah,
really something else. So,
it was very busy, I was surprised.
yeah. Yeah. They did a good show, not show, but they did a good,
Demo.
demo, yeah.
They do.
They did a fire in the back too, remember that? Wow,
Yeah, they actually set a fire.
yeah,
They built a fake room and set it
Yeah.
on fire, put it out.
yeah, good.
Good for them.
Red Cross was there and who else was there? There was a bunch of, who else was there?
The classes people,
What was that?
not the Shriners, the people at the big van. They were doing like health checks, glasses screenings, ear.
Oh,
screenings.
Lions.
The Lions, that's what they
Yeah.
are.
And
They
then
were
we,
there.
then we had the mosquito person in there, very good, stopping kids left and right. Cause she had all the pictures of the mosquitoes and they were like, oh, look at this, mom, look at this. Yeah, look at this, and the kids are all over that. It was pretty cool,
Good time.
yeah.
All right. See, we hit all our check marks. All right, 7:10.
Yeah, I think we all have all that we have left to do is if we want to set a date.
Yeah,
Oh, yeah, I think
let's set a November meeting date.
November 17th or in December 15th, we want to get up 2 days because if we don't, this room gets taken.
Okay,
So we try to use
so you want November 17th, December 15th?
December 15th if possible.
All right, how's November 17th for you, Matt?
Let's see. I think it's okay.
Um,
Looks okay.
Okay, let's set our next meeting for November 17th. And looking ahead, how's December 15th?
1 second. Is it the 15th?
December 15th.
Looks okay.
All right. Try and schedule for those two dates, November 17th and December 15th for our next meeting, so we can book our room. All right, any other business that we need to discuss?
Well,
Okay,
I don't think so.
fair enough. All right, it is 7:12. Carol is motioning to join the meeting at 7:12 PM. Do I have a second?
Second.
All in favor?
Aye.
Aye. All right. See you next